Hi, I'm Dr. Paul Dean, Mustang Veterinary Surgical. I practice just north of the Dallas-Fort Worth area. I'm a board-certified veterinary surgeon. The bulk of my practice is doing orthopedic surgery on lame dogs, primarily dogs that have cranial cruciate ligament rupture and are lame in the rear leg. Of course, there are many options available to treat cruciate ligament tear in the rear leg of a dog, but the TPLO remains the golden standard. I get the best results with the TPLO, and even with the newer techniques that are coming out right now, I have not been able to reproduce the excellent results I get with TPLO with those other procedures. Let me take a second and show you how TPLO works. So with the TPLO, we're not replacing the ligament. The ligament would go from here at the front, looking at the knee from side to side. Here's the patella or the kneecap. The ligament will go from here to here, from front to back. And instead of replacing that ligament, what we're going to do is use this bone, the tibia, as the vertical component. And what we want to do is take, as if this is a mountaintop, we want to take the plateau at the top of the mountain, and instead of it being at this angle, we want to rotate it to where it's almost perpendicular to the tibia. So we draw a line from the center of the tibia up through the middle of it, and another line that would illustrate the top of the tibial plateau, top of the mountain. And essentially, we're going to measure the angle that we have to rotate this component down in order to make it level. These angles are measured by the surgeon, and then we look at a chart to decide how much, depending on the size of the cut, how much we would rotate the plateau down. In this case, we have looks like a relatively average tibial plateau angle of about 26 degrees. And we want to rotate that down to about 4 to 6 degrees. So we'll look at a chart, and it'll tell us exactly how much to rotate depending on the size of the blade that we use to cut the bone. We have to do both joint surgery and bone surgery. The joint surgery can be done open, as in a standard everyday open procedure where you completely open the joint up and look in there with the naked eye. What is better, and what's the state of the art now, is arthroscopic surgery, where we go in with a small camera, a small tube, and have micro instruments where we manipulate things in the joint. It's very important that we get the remnant of the cranial cruciate ligament out, and also that we examine those menisci within the joint to see if they have been torn. So if your dog has a rear leg lameness that remains unresolved with medical therapy, please give me a call. I'd love to visit with you and your veterinarian about any surgical options that may be available to you.